Hey, welcome back to the show, everyone. All right, if you have pain in your feet, even before the workday is over, there may be some simple changes you can make that will get rid of your foot pain. And when it comes to shopping, many people especially feel this pain this time of year. You probably know it's called plantar fasciitis. Man, if you are exercising or shopping, you know you got it. Ira Kraus, great to have you here. How are you, buddy?
I'm good, Jed.
You look
How are
great
you?
In your sweater, you're
Thank
all
you.
festive. What is plantar fasciitis? Great name.
Plantar fasciitis is an inflammation of a ligament on the bottom of the foot called the plantar fascia. And I got to tell you, I see it in all kinds of people, large people, small people, athletic people, non-athletic people. I think there's a lot of symptoms that people should look for that they don't really look for.
All right, that's perfect. Let's go ahead and put this graphic up on the Ira. You know how television works.
Yep.
So here we go. Avoid repeated impact. And man, you know, when you get caught in an exercise routine, you don't want to because you're obsessed with this stuff.
I agree 100%. Some of the things that I think that we should look for is when you get up in the morning and you take that first step and you have pain. I call it the chandelier sign. Your pain hurts so much you want to jump up and grab the chandelier and get off your feet.
It hurts.
We call that post-static dyskinesia, getting up in the morning having that pain.
So you recommend what?
I recommend using a night splint, which is something that does static stretching. It actually helps dorsiflex the foot, so it stretches the heel cord and the plantar fascia, helping to relieve the pain. They work phenomenal. You can get them at a doctor's office, you can get them online, you can buy them in a pharmacy, but it's called a night splint. They work phenomenal.
All right, so you just wear it, and will the pain eventually go away, or does that require surgery?
No, 90 to 92% of all patients that have heel pain, it will go away. There's 8 to 10% of the people that no matter what we do, it will not go away.
Do you stop exercising when you wear
I tell people to reduce their exercise, consider some over-the-counter arch supports, consider anti-inflammatory medications, do stretching. If that does not relieve your pain, go to a professional. If you let it stay too long, then it becomes chronic. That's when we have a difficult time resolving it.
All right, let's go ahead and go to the second one. Taping? I mean, you can do that yourself?
Yeah, you can do taping. Athletic trainers do taping all the time. We call it a Lodi strap. And you can also actually buy pre-made tapes that will slip on your foot. We also have different over-the-counter products that we use that help. But taping is phenomenal, but you want to put the taping on tight. The key is making sure you bind that plantar fascia down.
So what are you doing? You're exercising, so why do you get this?
The plantar fascia gets inflamed and irritated. You normally get a bursal sac that develops.
Oh,
It's a shearing type problem, and a lot of people who do a lot of pounding on their heel. We find that I do see it a lot in people who do a lot of climbing. I see it in a lot of people who are truck drivers who are jumping in and out of trucks because they're landing on that heel
Like
and they're putting repetitive pressure.
All right.
Yes.
What about strengthening exercises? What can we do?
I tell people to play with marbles. I love when they take marbles with their toes and try picking them up. It helps strengthen the intrinsic muscles in the foot, which relieve the problem. The other thing that's really cool is to take a towel and crinkle it up with your toes and try and move it across the floor, just with your toes pulling a towel. That will help strengthen those inner muscles inside the foot and prevent the compensation that happens with plantar fasciitis.
I've never heard you say this before. All right, what about cold compressions? These are great things.
Ice and cold work phenomenal. And the simplest thing, you know, people sell all these fancy things. Buy a tennis ball, put it in the freezer, rubber conducts ice. You can get ice and stretching at the same time by putting just an old household tennis ball in. You can use a Coke can, put a Coke can in the freezer. Anything that will take the shape of the arch that you can roll back and forth is going to stretch out that ligament, and the ice will reduce the inflammation.
All right, you go to these huge box stores, you see these great machines and the pharmacy thing where you can stick your feet in and they're gonna make the insoles. Come on, there's competition for you, but are we doing the wrong thing?
I'm going to tell you why
you're doing it.
I am. The difference between the scanners that you're seeing in the office is that they can only do it in 2 different levels. You can only get 2 different planes.
You mean in the stores?
In the store, the scanners are only doing what's called a 2-plane scan.
Okay.
When we do a cast or a mold of the foot, we're doing it in all 3 planes, so we're compensating for every direction that your foot can move in. There's a special technique called subtalar neutral. If you're not molded or casted in subtalar neutral, the devices are not going to work. I have patients that spend hundreds of dollars on over-the-counter products, and then when they come in and I tell them you need something a little bit more custom, well, I've already spent $200 off the Kraus. They don't work.
All right.
I said it's not right.
I'm moving on to something else. High heels, women, parties. You hate them, don't you?
You know, I do. I will tell you that recently, and I was just talking earlier to Julie, a friend of mine just developed and patented a new high heel shoe for women called 34-minute shoes. They have their own website.
Wow.
It takes an average of 34 minutes for a woman's foot to start hurting in dress shoes. And these they've submitted for a patent on special insoles to help women wear high heel shoes. But in general, At this point, I tell people not to wear anything more than 2 inches. I recommend broad base instead of a stiletto because it gives you more stability. I think the biggest problem that you have is the type of foot that a woman has in a high-heeled shoe will cause more pain.
All right, few other things. Crocs and slippers this time of year, good for your kids? What do they say? Is this all?
No, actually, Crocs is a good shoe. Crocs actually has the APMA seal of approval. I will also tell you something very interesting. Crocs also has a medical line of shoes where you can actually go online and go to Crocs RX, and they have a special plantar fasciitis Croc.
All right, real quickly, you go work out, wear sandals or wear flip-flops in the shower. Can you get the fungus that way?
You sure can. But that's wearing the flip-flops and the sandal is better than going barefoot. I think that you have a better chance of protecting your feet from the fungus. I see too many people who walk barefoot in the showers, and I can't see how they do it.
All right, we're getting the big wrap real quickly. The shoes that look like the socks that you're wearing to run in. Do you like those things?
The Vibrams, I think they have their place, but I think you have to work your way in. Don't go transition from wearing a regular tennis shoe to wearing the Vibrams, and then you're going to have pain. You got to transition yourself in slowly.
You make feet fun, buddy. It's great to have
Thank
you
you
here, Ira. Happy holiday to you and your wonderful family. Here's the information. Dr. Ira Kraus, we love it when he's here. Foot problems, advanced foot care centers everywhere. 698-1966. Call that main number, advancedfootcarecenters.com. And by the way, Ira, we should say you have, you're able to use every hospital here. You have privileges there.
We're on everywhere in town.
A lot of respect for you. Ira, all the best.
Thank you.
Read a good book lately?
No.
We have got a great book for you. That's coming up next, right here on 3 Plus U.